Does your loved one have lymphedema with ulcers and wounds? I'm Bienstock, and I am a board-certified plastic and reconstructive surgeon. My expertise is wound care, and I'm going to help you manage your loved one in the home regarding their wounds pertaining to lymphedema. Well, first, before we talk about lymphedema, let's talk about what it is. The lymphatic system is a system in your body that drains fluid from your soft tissues, helps with the immune system and fight infections. It drains from the lower extremity or the arms into deeper things called nodes, or in the legs they're inguinal nodes, and the arms are axillary nodes. When this system is injured, meaning there's no fluid, it's almost like, think about it as like a hose that's kind of constricted. What happens? The hose starts to swell. So that happens with your legs. Most of the lymphedema I deal with is in the legs. However, you can get lymphedema in arms. You'll see this with cancer patients after lymph node resection or radiation. We're not going to talk about today because that's beyond the scope of this session. We're going to talk about lymphedema in the legs. So when the lymphatic system has been injured and there's swelling in the legs, it can lead to wounds. Just like we had talked about in venous stasis ulcers, when you get a preponderance of fluid, in this case it's lymph fluid, that's not being able to be drained adequately, it can cause toxin metabolites and lead to skin breakdown and ulcers and wounds. So how to manage this. So the most important thing is addressing the lymphedema. We have to squeeze that fluid, in this case the lymph fluid, as well as that edematous tissue, try to get that back into the deep lymphatic system so we minimize the swelling. Oftentimes with patients who have lymphedema, they have these really swollen legs. They look ballooned up and the feet are kind of small, as opposed to generalized edema where the leg is just swollen from regular tissue, or venous stasis, which affects the whole leg. So with these, it can be very difficult to manage, but that doesn't mean it's impossible to manage. In terms of wound care, you want to make sure you clean the wounds out on a regular basis, either every day or every other day. The most important thing is addressing compression, squeezing those legs out. Usually we use ACE bandages and Coban. We have to make sure there's no arterial disease, either via studies like ABIs or arterial Doppler studies. If there's no arterial disease, we can focus on really squeezing the legs and getting that fluid back into the deeper structures to drain that leg. In terms of wound care, we want to clean it out as before. We want to use something that's not going to stick, but it also is going to absorb all that drainage. I like to use Adaptic or some sort of contact layer that doesn't stick, but is semi-permeable, which means that there's little holes in it so the fluid can go through this dressing. And I use a lot of fluffy dressings to absorb that fluid, such as abdominal pads or hydroconductive dressings, followed by a Curlex roll, which is a wrap of gauze, and then ACE bandages and Coban. Sometimes I use something called TurboGrip, which is like a tight sock. Most patients that have lymphedema are not good candidates for compression socks because the leg is so big and so hard to get over the foot and the leg. I use something like TurboGrip or ACE bandages. Most of my patients that have lymphedema, I make sure they get what's called lymphedema pumps. These are these long sleeves that will squeeze those legs and squeeze that lymph tissue back into the deeper vessels so we can get the fluid under control as well as minimize the swelling. This is very challenging to heal. We usually have to do this in conjunction with good nutrition. But as I said, the most important thing is compression. You don't want to generally use gels and ointments because it makes the wound more messy and contributes to more drainage. We want to dry these things out. If you have any questions regarding lymphedema, ulcers related to lymphedema, please leave comments below. I'm happy to entertain your questions and comments. Make sure you subscribe to the channel when you get a chance, and I look forward to our next session. Thank you so much.